The Keys to Life, Involving Service Users in Meaningful Consultation.
Hello, my name's Susan Fisher and I'm a Speech and Language Therapy Manager in Fife. I also sit in the Keys to Life working group. The government document on the Keys to Life emphasises engagement with service users and the use of accessible information. This is incredibly positive, and we also see it as an excellent opportunity. But there is the danger that we assume that this is easy to do and that people will also know how to do this. In this film, we want to show that to be effective and meaningful, engagement has to be planned and supported. The project is a collaboration between health service speech and language therapists and social care staff, and also the service users themselves. The focus groups that we've chosen to do are supported by an evidence-based method called talking mats. We chose 4 topics from amongst the recommendations that were prioritised in Fife, and those that we chose to do were accessing hospitals, relating to the police and the criminal justice system, volunteering and employment, and housing.
The Scottish Government have identified 4 fundamental strategic outcomes for delivering the Keys to Life. These are healthy lives, choice and control, independence, and active citizenship. We believe that in order to achieve these, everyone needs to have an understanding of communication impairment and how we can better enable service users to be active participants in achieving these outcomes. This carefully designed and structured approach can allow people to think about topics and express their views and opinions more effectively without having to rely on using language alone. This is an example of a talking mat. Users learn to use 3 sets of symbols when completing a talking mat. Firstly, a symbol representing the topic that's being discussed is placed on the lower edge of the mat to reinforce the topic. Secondly, a visual top scale is placed along the upper edge of the mat, allowing users to indicate their general feelings about each topic and option. The meaning of the top scale can be adapted to suit the questions you're asking the person. For example, whether they are happy, unsure, or unhappy. Once the topic is chosen, in this example, my job, the user is given the options one at a time and asked to think about what they feel about each one. They can then place the symbol under the appropriate visual scale symbol to indicate what they feel. Before using a talking mat, it's essential to prepare well and think carefully about the question you want to ask, as well as the options you're going to present. It's helpful to think around your topic and discuss it with others to identify what you're trying to find out and how you're going to make the information meaningful for service users. A mind map can be a helpful way to prepare. A mind map is a technique that helps you to organise your thoughts and ideas visually in a diagram, bringing your thinking to life. In this clip, we see Laura and Amanda preparing for their talking mat session and using a mind map to think creatively about their topic, their top scale, and the range of options they want to use. Invitations were sent to service users to explain the purpose of the focus groups, and informed consent obtained using a specifically designed accessible consent form. Our discussion around police and criminal justice focused on finding out about the group's understanding of the role of the police. We aimed to find out their views on when and why you would talk to the police, and what they thought would make this experience easier. In this example, we wanted the group to consider what they would think about speaking to a policewoman. Each specific question was introduced to the group as a whole, with staff being available to help group members to talk through or consider their opinions. Although we gathered feedback from the whole group, each person had their own individual mat. This was to reduce the risk of group members being influenced by where others were placing their symbols, and potentially resulting in feedback not being representative. Each person put the picture on the mat dependent on what their opinion was. then transferred their feedback to a group mat, which allowed us to capture the feedback from the group as a whole and analyse the findings. Feedback from the focus group members identified that there was a strong consensus in the group of the police being someone who could help you, with the group identifying they would contact the police in the event of a break-in, theft and harassment. However, there's a potential need to liaise more closely with our colleagues in police and criminal justice to support adults with learning disabilities to develop a more robust understanding of the important role of the police in their community. The talking mats allowed us to gain some valuable feedback from our group. We found that the mats helped to generate some insightful conversations and supported group members to talk about their experiences.
I would talk to the police because family carers can't help you.
They, the police, could put words into your mouth.
Our groups focused on finding out about the experiences of accessing hospitals. This topic was broken down into two more specific topics: attending hospital appointments and staying in hospital. A similar approach was taken when facilitating this group, with members having their own individual mats and then each person contributing their views onto a group mat. Feedback from the group about their experience of attending hospital appointments identified the following. Most people reported that they were given written information about their appointment, but that some found it difficult to understand this information without the help from family, carers or staff. Most people felt that the length of their appointment was okay, but half of the group felt that they had to wait for too long. Most people felt that they got the help that was right for them when they went to the hospital. Some people reported it was hard to always understand what the doctors and nurses said to them, and some found it hard to speak to hospital staff and found it easier if their carers were there to help them. Feedback from the group about their experience of staying in hospital identified that everyone said that the ward was clean and the beds were okay. Everyone thought that the visiting times were okay, although half of the group did not like the food. Again, we found that the process of talking mats stimulated valuable discussion from group members about their own individual experiences.
They took time with me and explained what they were going to do. I felt brave.
I got a bit lost. It's absolutely complicated.
Members of this group were either currently in a paid employment or volunteering role, or had experience of applying for jobs in the past. Feedback from the group about their experience of employment and volunteering identified that most people said that they got help to apply for jobs. Most people said that they would not have been able to apply for a job without getting help from staff or the employment service. Half of the group were able to choose what type of job they took, but that choice was not available for everyone. Most people said that they got training for their job, but some people said that they found the training difficult to understand and to remember. Everyone said that they got help in the workplace, but most people were unsure if they got help to learn to do new things. Half of the group said that the money was not okay. These people had voluntary jobs and wanted to be paid for working. Again, we found that the process of talking mats stimulated valuable discussion from group members about their specific experiences.
Fife employment came into the centre and helped.
They make you feel it's your fault because you don't have a job.
Service users who participated in our focus group about housing had collective experience of a range of housing support services. Some individuals perhaps still lived at home with their families, whilst others lived on their own or in a shared tenancy with varying degrees of support from paid carers. Overall, the feedback from the talking mats was very positive in relation to the group's experience of living in their own house and the support that they received. However, when the group was supported to discuss their experiences further, individuals described very different views and opinions in contrast to what they had portrayed on the talking mat. The discrepancy between what people express on the mats versus what they express during conversation highlights some important factors that we need to consider when using talking mats. Firstly, it's important to ensure that the person has an understanding of how to use talking mats. It may not be a tool which is suitable for everybody, and some people benefit from lots of opportunities to practice using talking mats before it can be determined if it is the right tool for them. We also need to take care to interpret the results produced from a talking mat session, not just by considering what people convey visually on the mat, but also by listening to what they say and how they say it. It is often the discussion around the concepts that provide the most valuable information.
We don't get a choice, just have to take who they have got.
I enjoy not having staff from 10 p.m. until 8 a.m. anymore. Their change is over time, and I am happy with this.
We asked some of the service users involved in the talking mat sessions to tell us what they thought. Here's what they had to say about using the talking mats approach. If each of you got something you want to say about the group, maybe something you enjoyed, things you didn't like about it, things that could have been better.
That's good.
Then tell us.
That's
I just want to hear
you
what
like
you think.
I found it interesting, and I found it really educational, and the tutors that was there, they were quite good. Found the topics really interesting because I stay on my own, and the police justice one was really good.
I think the group was very interesting. I thought the criminal justice system was interesting. It's very educational.
I think the talking mats and were very helpful. If there's any more key life, can do it. I've enjoyed it.
Some people like me can read, doesn't like the talking mats, and would find it very interesting, just a piece of paper.
I think it's interesting. I think it's good. Learning things. Educational. It's interesting.
It's very good staff that works at Keys for Life. It's good staff. Thank you.
I think the Keys to Life strategy is a good thing. Maybe a 10-year strategy, but it's a good thing that they're doing, making things for people with disabilities better.
When we first started out on this project, we were most focused on the information or answers we would get to the questions we asked about the 4 topic areas identified from the Keys to Life recommendations. We soon realised that although this is very important, we are only at the beginning of a much longer process. The most important and longer term aim is to ensure meaningful engagement with service users in Fife across a range of issues and services. As a starting point, this requires a good understanding of the communication difficulties experienced by service users with a learning disability. The use of talking mats within the focus groups has demonstrated that this is one important tool which will support this process. To ensure that service users are meaningfully engaged, we have decided that we need to bring on board carers and staff across more organisations in health, social care and the third sector by providing widespread training in the understanding of communication difficulties experienced by service users as identified as part of the PACT project. Following this, we need to provide widespread training and support in the use of accessible information and talking mats to allow meaningful engagement with service users. We need to use these skills to engage with and hear the views of a wider range of service users across a spread of service provisions. We design and deliver services for adults with learning disabilities, and it is crucial that they continue to have meaningful opportunities to influence how our services continue to be developed. We need to write up a report from this project and actively seek to share this with lots of different people along with this DVD as an example of good practice and to generate more interest in the process. We believe that unlocking the keys to communication is central to meaningful engagement and unlocking the keys to life in Fife. We would like to thank all staff and service users who took part in the making of this film.
Here come the cakes.
Were you involved in making these cakes today? Yes. Thank you very much. Thank you.
Thank you very much, Ian.
Fabulous.